Invasive breast cancer, stage 0 to stage 2 overview. People with cancer need support and information, no matter what stage of illness they may be in. Knowing all of your options and findings, the resources you need will help you make informed decisions about your care. Whether you are thinking about treatment, getting treatment or not, being treated at all, you can still get supportive care to help with pain or other symptoms. Communicating with your cancer care team is important so you understand your diagnosis, what treatment is recommended, and ways to maintain or improve your quality of life. Most breast cancers are invasive, but there are different types of invasive breast cancer. The two most common are invasive ductal carcinoma and invasive lobular carcinoma. Less common types of invasive breast cancers. These include adenoid cystic carcinoma, low-grade adenosquamous carcinoma, medullary carcinoma, mucinous carcinoma, papillary carcinoma, and tubular carcinoma. Some subtypes have the same or maybe worse prognosis than invasive infiltrating ductal carcinoma. These include metastatic carcinoma, most types including spindle cell and squamous, except low-grade adenosquamous carcinoma, micropapillary carcinoma, mixed carcinoma, which has features of both invasive and ductal and lobular. What types of cancer are diagnosed as stage 0 and 1? Breast cancer. The stage of cancer indicates the size of the tumor of abnormal cells and whether or not those cells are contained to the place of origin. The most common type of breast cancer is ductal carcinoma in situ, indicating the cancer cell growth starts in the milk ducts. What is the term in situ mean? Stage 0 cancers are called carcinoma in situ. Carcinoma means cancer and in situ means in the original place. Three possible types of in situ carcinoma of the breast tissue are DCIS, ductal carcinoma in situ, LCIS, lobular carcinoma in situ, and Paget's disease of the nipple. What is stage 0 DCIS? Stage 0 breast cancer, ductal carcinoma in situ, is a non-invasive cancer where abnormal cells have been found in the lining of the breast milk duct. In stage 0 breast cancer, the typical cells have not spread outside of the ducts or lobules into the surrounding breast tissue. Ductal carcinoma in situ is very early cancer that is highly treatable, but if it's left untreated or undetected, it can spread into the surrounding breast tissue. What is stage 0 LCIS? Lobular carcinoma in situ at stage 0 generally is not considered cancer. Although it has carcinoma in the name, it really describes a growth of abnormal but non-invasive cells forming in the lobules. Some experts prefer the name lobular neoplasia for this reason because it accurately refers to the abnormal cells without naming them as cancer. Lobular carcinoma in situ, however, may indicate a woman has an increased risk of developing breast cancer. What does it mean to have stage 1 breast cancer? In stage 1 breast cancer, cancer is evident, but it is contained to only the area where the first abnormal cells began to develop. Stage 1 can be divided into Stage 1A and Stage 1B. The difference is determined by the size of the tumor and the lymph nodes with evidence of cancer. Stage 1A breast cancer means the following description applies. The tumor is smaller than approximate size of a peanut or 2 centimeters or smaller and has not spread to the lymph nodes. Similar to stage 0, breast cancer at this stage is very treatable and survivable. When the breast cancer is detected early and is in the localized stage, there is no sign that the cancer has spread outside of the breast. The 5-year relative survival rate is 100%. What should a person with stage 0 or stage 1B, stage 1 breast cancer expect regarding treatment? Even though stage 0 breast cancer is considered non-invasive, it does require treatment, typically surgery or radiation, or a combination of the two. Chemotherapy is usually not part of the treatment regimen for early stages of cancer. Stage 1 is highly treatable. However, it does require treatment, typically surgery and often radiation, or a combination of two. Additionally, you may consider hormone therapy depending on the type of cancer cells found and their additional risk factors. Like stage 0, chemotherapy is often not necessary for earlier stages of cancer. An overview of stage 2 breast cancer. Stage 2 tumors are usually between 2 and 5 centimeters in diameter and may or may not have spread to lymph nodes. Treatment usually includes surgery, either lumpectomy or mastectomy, and adjuvant chemotherapy is often recommended. Radiation therapy is given following a lumpectomy, but may or may not be needed after a mastectomy. If the tumor is estrogen-receptor positive, hormonal therapy is usually given for 5 to 10 years. And for those who are postmenopausal, bisphosphonate therapy may be recommended as well to reduce the risk of recurrence. If the cancer is HER2 positive, targeted therapy is often used as after primary treatment. Stage 2 breast cancer is considered invasive, meaning that the cancer cells have broken out of the ducts or lobules of the breast. This is not the same as metastatic or stage 4 breast cancer. It simply means that abnormal cells have passed through a thin layer of tissues called the basement membrane and have the potential to spread. Cancers are scored and divided into stages by something called the TNM system. Stage 2 cancer can be either 2A or 2B. T stands for tumor size. In stage 2, the T score can range from 0 to 3. T0 means the tumor cannot be detected in the breast. T1 include tumors that have a diameter of 2 centimeters or less. T2 include tumors that are between 2 centimeters and 5 centimeters in diameter. T3 tumors larger than 5 centimeters in diameter. N stands for lymph nodes involvement. Stage 2 can be either 0 or 1. NO would mean that cancer has not spread to any lymph nodes. N1 means describe cancers that have spread to lymph nodes, but the spread can only be detected under a microscope. N1 is used to describe tumors that have spread to at least one lymph node near the tumor. M stands for metastasis. All stage 2 cancer is MO, meaning no metastases are present. Stage 2 breast cancer, stage 2A, TON1MO, TO no tumor, and 1 with lymph node, MO, no metastasis. Stage 2A, T1 and 1 MO. T1, 2 cm or smaller that has spread to at least 1 lymph node, no metastasis. Stage 2A, T2 NOMO, T2, 2 cm or less than 5 centimeters, no lymph node and metastasis. T2 N1MO, tumors 2 cm and less than 5 centimeters with lymph node but no metastasis. T2B, T3, tumor greater than 5 centimeters but no lymph node and metastasis. This is the picture of the stage 2A and stage 2B. No tumor but cancer found in lymph nodes. Tumor is 2 cm or lower. Cancer is also found in lymph node. Tumor is 2 to 5 centimeter. No cancer found in the lymph nodes. Stage 2A. Stage 2B, tumor 2 to 5 cm, considered with cancer found in the lymph nodes, and tumor greater than 5 centimeter. Stage 2B, 2 to 5 centimeter tumor, cancer has spread to the lymph nodes. Tumor larger than 5 centimeter, but no cancer in the lymph nodes. Treatment, breast cancer stage 2. Local treatments, surgical choices will include a lumpectomy or a mastectomy, which may be followed by radiation treatments to the breast or chest wall. If radiation is recommended, that will affect the timing of any breast reconstruction that may have. If you opt for a mastectomy, it will also be important to consider the pros and cons of having a single or a double mastectomy. Systemic treatment or adjuvant therapy. These therapies will affect cells all over your body and will help prevent a recurrence. Depending on your age, general health, hormone receptor status, lymph node involvement, and HER2 testing results, you may be given chemotherapy, hormonal therapy including either tamoxifen or an aromatase inhibitor, or a HER2 targeted therapy such as Herceptin. Neoadjuvant treatment. You may prefer breast-conserving surgery but have a tumor that is too large to have a good result after lumpectomy. In this case, your oncologist may suggest having systemic treatments before surgery in hopes of shrinking the tumor. When this approach is successful, the smallest tumor can be removed and local treatment may be given if needed. Some tumors don't respond well to pre-treatment. When that happens, a mastectomy will be necessary. You may then consider breast reconstruction. You may spend 3 to 18 months or longer in the active treatment of stage 2 breast cancer. It may be as simple as surgery and 6 weeks of radiation, or involve the full array of chemo, radiation, and biologic therapies. The 5-year survival rate for stage 2 breast cancer is 93% for women who have completed treatment. By contrast with stage 3 cancer, have a 5-year survival rate of 72%. Follow-up care. Irrespective of the course of treatment you undergo, you will have a 5-year minimum follow-up period with your oncologist. Check-up will take place every 3, then every 6 months. During this time, you may need to take hormone therapy if your tumor was hormone sensitive. Some oncologists are now recommending hormonal therapy that goes beyond 5 years for those with estrogen-receptor positive tumors. If your tumor is estrogen-receptor positive, your oncologist may also recommend that you use bisphosphonate therapy if you are postmenopausal. Phosphonates are medications that are used for osteoporosis but appear to help reduce the chance that breast cancer will spread to bones, the most common site of metastasis. Unlike some cancers, routine scans are not usually done after primary treatment for stage 2 breast cancer has been completed. The reason for this, even though recurrence is possibility, is that finding recurrence early does not improve survival. For those who have finished treatment, it is important to be familiar with the potential signs and symptoms of a recurrence and to contact your doctor with any concern. After 5 years, you may only need to see your oncologist annually, but this visit must often continue throughout your life. Checkups are important to make sure that recovery is going smoothly and that treatment for recurrence won't be needed. If you've been diagnosed with stage 2 breast cancer, the outlook is very good. You are more likely to have chemotherapy and or radiation therapy than if your tumor was stage 1. But these tumors are still very treatable. Research done by Dr. Ray J. Libaki. To hear about stage 3 and stage 4 breast cancer overview, please subscribe to my channel and click the notification bell button. Thank you.